While effective against spreading COVID-19, masks have caused some concern for those with respiratory ailments and those outside in the heat. Dr. Gary Cianci, a physician at Roper St. Francis Express Care, says if you have a baseline lung disease such as COPD, asthma, or in a state where you have restricted airflow, you may want to consider a few things.
You can wear a mask where you can go. You may take caution if you're having a bad day with your lungs as far as your lung health. You may not want to go places where there's a lot of people where you have to wear a mask. You might want to remove yourself from the situation where mask wearing is encouraged.
Even more, with masks being worn in heat from outside, there's an additional concern of a heat stroke or heat exhaustion. Dr. Cianci still advising that wearing a mask is best, but when outside, you should know the signs to look for.
Initially, a lot of sweating, initially kind of feeling lethargic or fatigued. Then you start to get dizzy, you start to get disoriented. If you see someone around you starting to stumble, starting to not make sense with what they're saying, it's important to try to recognize that and try to remove them from the heat.
As for preventing this, Dr. Cianci is saying, mask or not, the first step is drinking water before and during heat exposure.
Drinking water throughout the time that you're going to be exposed to heat. Having some cool towels is also a good idea. Another thing which can be helpful if you have access to it is air movement or airflow.
For more resources, including how to take off your mask properly, you can find that on our website. That's counton2.com. In Charleston, I'm Cait Prestak, Count on 2.